So if you're watching in our 7 o'clock hour, you might have heard last night that there was a TB case, a tuberculosis case that had been identified up in the high country in Avery County. There was some contact tracing underway, and we're hearing between the health district and the school system, which were both involved with notifying potential close contacts, there might have been upwards of 100 exposures from this one case. So we wanted to speak with some health experts to get some context about how serious this case might be, how easily this might be able to spread to these potential close contacts, what the process is for treatment, all of the things you need to know to stay safe. And actually just wrapped up a few moments ago an interview with North Carolina Department of Health and Human Services with some of the answers y'all probably have to the questions surrounding TB. So let's listen in. So we have Erica Wilson, who is with the Division of Public Health within North Carolina Department of Health and Human Services, joining us to give us a little bit more context on tuberculosis. Erica, thank you so much for your time.
My pleasure.
So let's start off, I guess, with some basics here. What is tuberculosis?
So tuberculosis is a bacteria, Mycobacterium tuberculosis, that most commonly causes an infection in the lungs, but can also cause infections other places in the body, and can cause severe disease if left untreated.
And so exactly how does it spread?
So you get tuberculosis when somebody who has an active infection with tuberculosis of the lungs coughs, sneezes, talks in the same airspace as you, usually over a prolonged period of time inside. It's not diseases like COVID or measles, where it takes very little contact often. Usually it takes a more prolonged time, several hours in an enclosed space for transmission to occur.
Oh, I mean, you mentioned COVID, and I remember for some time, particularly during the pandemic, we did see COVID, top the list of, diseases that cause death. Essentially, it was among the top causes of death globally. And then I feel like maybe it was over the past fall, we saw kind of a shift in things, and tuberculosis had actually surpassed COVID, if I remember correctly, as far as, a leading cause of death. What do the trends look like right now? Is that still the case? What I'd mentioned about, its relation to COVID, and what do the trends look like with tuberculosis?
So those numbers are global numbers. There are many other countries in the world that have much higher tuberculosis burdens than we do in the United States. So globally, tuberculosis has historically been one of the leading infectious causes of death from especially respiratory infections. However, in the United States, COVID still far surpasses TB for respiratory infections and deaths. We had in North Carolina about 250 TB cases last year in the entire state. We had many, many more COVID cases than that and many more COVID deaths. So for most people in North Carolina, COVID remains the greater health risk.
That's interesting to know. I mean, we mentioned as well, in reaching out to DHHS, the fact that we were kind of prompted to ask some of these questions because there is a case out of Avery County where we were seeing the health district there reporting upwards of 100 people potentially could be close contacts of this one TB case. And I guess we were just kind of curious how contact tracing would work and what was, the process for these folks having then getting a call from the health department, what would go, on after that, after that phone call is made.
Yeah, so because TB can be so dangerous, we do take it very seriously when we have an active case, and we talk to that individual about where they've been, who they've spent time with, and identify those people who have spent a significant amount of time with them during their infectious period. And because the symptoms of TB can be very similar to the symptoms of other respiratory conditions, sometimes people can be sick for a while before they get diagnosed, and this can lead to a lot of exposures. So those folks that are identified as contacts, they will be contacted by the health department and offered free testing. That can be either a blood test or a skin test. And often that testing is repeated after 8 weeks because those tests are looking for your body responding to the TB bacteria. And sometimes that response takes a while to develop. And so those folks will be offered that testing. Anybody who has a positive test will be offered treatment for what's called latent TB. So you can have TB in your body that your immune system is controlling and is not causing any active disease. It's not making you sick. And that can be treated more easily than active TB, and prevents you from going on to developing TB in the future. And so those folks, anybody who does have a positive test will be offered that treatment free of charge by the local health department, to prevent them from developing active disease in the future. And so for those folks, it is also very important for them to finish those medications, because not finishing them can lead to drug resistance in the TB. So it is unusual to have TB spread, but when it does, it is very important for those contacts to get tested and to complete the full treatment from the local health department if they have latent TB.
I mean, the way you described it, it certainly sounds very treatable. Are the outcomes usually really positive? You know, if you are able to catch a case, you know, pretty well on, and the person goes through the full doses of all they need to take and such. I mean, does it seem like that's a pretty good guarantee that you'll overcome this and survive?
Yes, and especially for latent TB, those folks aren't sick and they get treated and they never go on to become sick because they received appropriate treatment. With active disease, it can be treated as well. And that treatment is a little bit harder. It's a little bit longer, just because it does take multiple medications. But that is also generally treatable.
I mean, we talked about the treatment. Are there any sort of preventions?
Yeah, the best prevention is that latent TB treatment. So if you've been exposed, or if you've spent time living in or traveling to a country where TB is common, then getting tested for that exposure to see if you have the bacteria in your body that your immune system is controlling. And if that test is positive, then completing that treatment so that you do not ever go on to develop active TB.
But there's really no vaccination that we would do, at least maybe not in the United States, is kind of like a preventable type situation.
Yeah. The vaccination available, some people hear about, it's used in other countries where TB is more common to prevent TB in small children.
Got it. And I guess, are there certain demographics or, you know, a line of work, or maybe there's a lifestyle factor that makes somebody more susceptible to catching TB?
Yeah, so TB, the folks who are most risk for TB are those with conditions that make their immune system less effective. And so that could be diabetes, cancer treatments, immunosuppressant medications for somebody who has an autoimmune condition, HIV, and just general nourishment and immune status. So that's more common in other countries than here. But so anything that suppresses the immune system can make you more susceptible to TB. Also things like tobacco use can, just because that affects the lungs, can make you more susceptible.
Got it. And I mean, I guess I should ask about travel. I mean, you talk about this being more prevalent in certain parts of the world other than the United States. So, I mean, would it be safe to say, if you are going to maybe specific countries where there are many more cases, that this is a possibility of, you know, something that you could catch?
It is possible, but it really depends on kind of the activities that you'll be doing and how long you'll be there. So this is not something you're going to catch passing somebody in the grocery store aisle. It takes more prolonged exposure. So going somewhere as a tourist where you're going to be either outdoors or not spending long periods of time indoors with folks outside of your traveling party, then that risk is not high. If you're living there and spending long periods of time with folks, that is a higher risk.
So, I mean, we kind of touched on general symptoms in the sense that this does, as you mentioned, kind of seem to present as a lot of other respiratory type illnesses, in that there's a cough. I remember fever, fatigue, weight loss. But I guess, at what point would you feel like this might be something more serious than, let's just say, I have a cold or a really bad cough, or maybe even COVID or the flu?
Yeah, so usually those symptoms for COVID or the flu or cold are going to get better within the 3 weeks. You might feel really horrible for a week, but then you're going to be getting better. For TB, that's going to be prolonged symptoms. So a cough lasting at least 3 weeks. Folks will have tiredness, weakness. They may have unintentional weight loss. night sweats where you just wake up in the middle of the night drenched with sweat. So that kind of constellation of symptoms would be something to go and ask your doctor about.
Got it. And yeah, I guess on that note, what else can folks do to get help other than going to the doctor, and or if they feel like they are starting to have something that's much more than a cold, what could they do maybe to even limit exposure to other people that might be around them?
So not being in the same airspace, so not in the same room or wearing a mask if you're in the same room. And it's especially important if somebody is thinking they might be sick with TB while they're waiting to get to the doctor, to not spend a lot of time around small children. Children under 5 are particularly at risk for severe disease from TB. And so if you think you may have TB while you're waiting to see the doctor, to go to your local health department, because your local health department can do all of that testing for TB at no charge. To not spend time in close contact with small children.
Yeah. I mean, it's unfortunate that we had to have a case to have this conversation, but it's always great to have, more public awareness about, communicable diseases and how to handle situations. Is there anything you'd like to share with the public just about tuberculosis in general, maybe even infectious diseases overall, or, just any sort of messaging so folks, have an idea of best ways to take care of themselves?
Yeah, I'd say TB is a very scary disease. It can be very serious, but we do have great resources here for treatment and testing for TB. The local health departments do a great job in investigating these cases and providing treatment to folks with TB. And so most people in North Carolina are not at risk for TB, just because our local health departments have done a really good job over the years controlling that and reducing the number of cases.
Is it safe to say that this is a priority, illness to have supplies on hand for a health department? Like, this is something that's been, kind of kept at the top of the list of diseases that y'all want to keep under wraps?
Yeah, TB is definitely a disease that we want to maintain, as not very many cases in the state, and that every health department has to be prepared for.
Yeah. All right. Erica Wilson, thank you so much for joining us. We appreciate your insight.
Thanks for having me.
Did want to mention as well that we did ask North Carolina Department of Health and Human Services if they were able to share any more about the specific case. They say because of privacy issues, they could not, because we did have a question about why the school district was involved with contact tracing alongside the health district. But unfortunately, they couldn't shed any light on that. But if we get more details, we'll definitely pass this along.